Rob here said the GP 6 to 7 is sort of what I recommend, not so much with cardiologists. When I asked to hear more, he said, my regular doctor is open and willing to discuss, but cardiologists have been very set. Take this, take a statin. What is going on there, Dr. Ravadia, with why cardiologists, at least in Rob's experience, are more formulaic, let's say?
Yeah, I think this is very unfortunate what I see in my colleagues that are cardiologists. They've been very programmed that there is only one way to take care of heart disease, and it is all about one number on a blood test, right? Your LDL cholesterol level. Whether or not they're right or wrong, the one thing that I can say is after 25 plus years of dealing with it, right? Heart disease is complex. And to think that we can reduce it to one number on a blood test is foolhardy. But that's the corner that cardiologists have been backed into, that the only way to manage heart disease is by controlling that number, right? And mostly relying on pharmaceuticals to do so. And at this point, I just find it sad. A story that I repeat often is when I was finishing my training as a surgeon and deciding what area of surgery to specialize in, most of my mentors discouraged me from going into heart surgery. This is early 2000s, right? 2001, 2002. And they told me that there was going to be nothing left to do as a heart surgeon in 20 years because we figured out heart disease, cholesterol, statins were just at their peak, becoming the most commonly used medications in the world. And the general consensus was that heart disease was solved and there's going to be nothing to do as a heart surgeon. And so don't go into that field. Here I am 25 years later, busier than ever. There is actually a shortage of heart surgeons in this country. There are not enough heart surgeons to do all the surgery that needs to be done. And that tells us that we obviously got something very wrong in that thinking that heart disease is all about cholesterol.